Internationally, we know that most children fail to meet physical activity guidelines, which recommend that children meet 150 minutes of physical activity per day. But school-based physical activity programs can actually help children meet those guidelines. So as a result, a number of governments internationally have recommended schools implement physical activity policies or programs, but unfortunately we know that only a small proportion of schools implement these policies because they face lots of challenges when they go to implement the policy or program. We knew that schools were facing a number of barriers to implementing the 150-minute policy, and so we piloted what was going to be most effective. And from that pilot we saw immediate significant impacts on children's physical activity. So then to be able to scale it to 100 schools, I think it's quite exciting. So the PACE project, which stands for Physically Active Children in Education, is supporting schools implement the mandatory 150 minutes of physical activity across the school week. So we're working with 100 schools across the Hunter, New England, Mid-North Coast and Central Coast regions and supporting their teachers to schedule 150 minutes. And this 150 minutes can come from PE, sport, energisers or integrated lessons, so where you're making maths or English more active by incorporating physical activity into those traditional sedentary lessons. Well, in the short term, if schools are scheduling this 150 minutes, then immediately we would hope to see that children are more active, which has immediate flow-on effects. We know that activity in schools can increase students' attention, it can increase their connectedness to the school. Long term, if this becomes embedded in school practice and what children receive from kindergarten to year 10, then hopefully it becomes a behaviour that flows on to their everyday life, and the potential long-term effects on children's health could be substantial. This MRFF project is a collaboration between Hunter New England Local Health District, Mid-North Coast and Central Coast Local Health Districts, as well as Hunter Medical Research Institute and the University of Newcastle. We're also very fortunate to have a number of other international collaborators from University of British Columbia and Harvard University, as well as Sydney University. So we're very fortunate to have this expertise available to us for this project. As a former teacher, it's really thrilling to be able to see this project in schools making a difference. Teachers have reported that it has completely changed the way they teach in the class, and they are seeing the direct impact on children in their concentration, their enjoyment, wanting to come to school. They know when it's energiser time, so they're now actually even asking for it. So we're really excited that this is making potentially a huge impact in children's lives, as well as hopefully their families and the teachers in the school.